Hello friends, let us now learn some important points about thyroid USG. So, before we go into thyroid USG, thyroid is present in the superficial location of the body. So, because it is present in the superficial location, that too in the neck, so this thyroid we can do ultrasonography of thyroid. We can do ultrasonography of thyroid along with color Doppler. So, for thyroid ultrasonography, we can use high frequency transducers can be used for ultrasonography. This high frequency meaning the frequency of 7.5 to 15 megahertz transducers are necessary, which these transducers, that is high frequency transducers, will provide a depth of 4 to 5 centimeters. They provide a penetration of 4 centimeters. So if this is the neck and this is the patient has been extended, okay. So this high frequency transducers will provide a depth of around 5 centimeters to the patient. So we will have a high definition images and the resolution of this high frequency transducers is around 0.5 to 1 millimeter. So this high frequency transducers will provide a better image of thyroid. We can also use the high frequency transducers, these linear array transducers, or we can say linear probe. In the ultrasound, we have three probes: curvilinear, linear, and endocavitary probes. So we will use a surface high frequency transducers, which are nothing but linear probe, is used for assessing the thyroid gland. And these linear array transducers will give either a rectangular format of scan or they might give a trapezoid scan format is given, and this will help us in better visualization of the thyroid gland. So next, if you see this thyroid gland, it is supplied by superior thyroid artery, inferior thyroid artery. So we can say that the thyroid gland is most vascular organ of the body. Because it is most vascular organ of the body, Doppler examination is also very useful in assessing the disorders of thyroid. Recently, we have two new techniques have also been developed for the thyroid gland. So these two new techniques are also ultrasound techniques which can be used for assessing the status of thyroid gland. These two techniques include contrast enhanced ultrasonography and elastography are also important in assessing the thyroid gland. So first we'll see some important points about contrast enhanced ultrasonography. This contrast enhanced ultrasonography, here we use some contrast agents are used. These contrast agents are used and this will have very low mechanical index. Okay, so this contrast enhanced ultrasonography will is mainly helpful in conditions of some cases of nodular disease, and it is also used for some ultrasound guided procedures. For some ultrasound guided procedures also we can use this contrast enhanced ultrasonography. Followed by that, we have second technique which is called as elastography. This elastography is a principle where the transducer is placed over the skin of the patient, and if the transducer is placed over the skin of the patient and we press it, we apply force over the skin. This will compress the tissues. So once the body tissues are compressed, that is, compression of these tissues will cause deformity of the soft parts. That means on compression, the soft part will get deformed. Okay, this deformation is measured, or that means, for example, you are trying to compress this tissue. There is skin and this is the transducer. We are trying to compress this tissue. Once we compressed it, the rays, ultrasound signals, which are, that is, ultrasound is nothing but sound waves. The sound waves will reach the tissues, and some of them will get reflected back and some will get transmitted, right? Those reflected rays are caught by these transducers, which provides us the image. So here what happens is that whenever you compress it, this amount of displacement at various depths, this amount of displacement can also be found out by these reflected rays, which we get before and after compression. That means one scan you do normal ultrasonography, you'll get an image. The second scan you do with compression. So if you do two scans, one normal image, second compression, you will get the displacement. You will find out the displacement of tissues. So based on this displacement of tissues, you can calculate the strain which is important for displacing the tissue can be calculated. By that we will find out the elasticity of the tissue can be calculated. So this is elastography. Okay. Now, for doing a thyroid ultrasonography, first and foremost, the patient is placed in the supine position, and the neck, see the neck here, the neck is extended in the patient, and also you will have to place a small pad. This small pad is placed below the shoulders or under the shoulders. When the pad is placed under the shoulders, this will cause better extension of the neck and you will have a better exposure of the neck. So this pad, keeping a pad below the shoulders is not done in all persons. It is mainly important in patients who are short and who are stocky. That means who are short and fat. In them, you can, in order to get better exposure of thyroid gland, we can use a pad below the shoulder. Then then you can keep the probe either in transverse axis or in the longitudinal axis. So the probe is placed both in transverse axis and also in longitudinal axis, and the thyroid gland is assessed in both the axes, that is both in transverse axis and also in longitudinal axis. So you will have to examine the entire gland including the isthmus. You will examine the isthmus, you will examine both thyroid glands, and the entire gland is examined. Then you will also have to see the carotid artery and jugular veins. So this is the artery, which is carotid artery, and this is the vein, internal jugular vein, and this is the carotid artery. Okay, both these should also be seen, along with any lymph nodes are also assessed. Okay, now the one more important thing is that, okay, you should assess the internal jugular vein and also carotid artery. So this is the important points about the ultrasonography of thyroid, that is instrumentation and technique of imaging the thyroid gland. Thank you.